Alright, so hello everybody. How are y'all doing today? I hope everyone had a great week or weekend or midweek, depending on when I post this video. So basically, for those who have been following my last three or my first three, four vlogs, I kind of didn't do like an introduction or, a what is lupus video. You guys just kind of been following me on my journey so far. I didn't really get to record like the beginning, my diagnosis, my signs and symptoms when I first went into the hospital in December, but those things I will more so talk about, but I'll still continue to like video blog everything and blog. Have to get back on that, but I'll continue to do those things throughout because it's still the beginning of this journey. I'm still not fully manageable yet, so I'm sure I have a lot more to share as far as like, the beginnings of being diagnosed with lupus. But, right now I'm just in a t-shirt and my heated blanket. I just got out the hospital yesterday. I missed work all week because I had a bad flare-up. And I'll discuss what flare-ups are. Some of you may already know, but some people you don't know. You just follow my journey, which is great. But I love for you guys to know a little bit more about lupus, mostly, and about what's going on with me. I wanted to do this video, one, because of awareness, and two, you guys that are following, like my friends and family, I've noticed that, I still have family that call my mom and ask, so what is lupus? They've been praying, but, don't know, exactly what is going on or what it is, which is okay when somebody tells me to pray for them, I pray for them no matter what, no matter what's going on. It may not be my business what's going on. You just have to, drop to your knees or whatever and pray for that person. So, but I do want you all to know, I'm not ashamed. I don't hide too much of anything when it comes to my health because I look at it more as a testimony, awareness, and to help someone else who may be going through the same situation or any type of chronic illness, whether it's asthma, colitis, cancer, just diabetes, anything, because all these diseases, they do change your life, and they can change your life drastically, just like that. I mean, one day I was fine, and the next day I became disabled or handicapped or whatever you want to call it, just like that. So it can be life-changing in the blink of an eye, and, you need support, you need help, you need someone to talk to, and you need somewhere to look, somewhere to get encouragement from, awareness from. And I noticed, like, even on YouTube, there aren't that many videos. There are a lot of people that, there's a few people that I've seen do video vlog or, lupus videos too. And, that's where I honestly actually learned a few things about lupus and just to see their daily lives. So I'm just like, I have that same issue or I have something similar. So I hate that anyone is going through this, but, it's good to know that you're not alone or that, you're not crazy because you're having these issues or symptoms, or you're not going to die like that just because you're having some type of crazy illness. It's kind of good to see that someone else is going through it, and made it out too, just having this random crazy thing that just happens. So I wanted to do this video. It's going to be my what is lupus video, and I said in my blog that I was going to go into like different things because, you guys aren't too aware about certain things. Like I mentioned in my other video, like the butterfly rash and some of my other symptoms that I had. I'm still not going to go into too many of them on this video because I have another video that I'm going to do about my diagnosis and how I was diagnosed, and then another video is going to be about the signs and symptoms of lupus. So I'm just going to kind of like talk about it in a general phase, and then I'll talk about my personal signs and symptoms in a different video. But I put together a definition and I put it on my phone because I did not want to miss anything just sitting here talking, because I wanted to make sure I give a very clear, concise definition on what lupus really is, because I don't want to, like I said, miss anything. So I'm going to read off my phone. So, and I'll just stop. It's kind of long, to be honest, and I'm going to just stop and kind of like explain some things. So I just read it, it's like, okay. So I'm going to stop in between my little areas here in my reading. Okay. So lupus is a chronic autoimmune disease that can damage any part of the body. So, first of all, what is an autoimmune disease? So an autoimmune disease is your immune system basically is damaged. So that's why it's called disease. Anything that's not normal or that's abnormal when it comes to your health is considered pretty much a disease if it's been qualified to be a disease. So it's very chronic. So lupus is a chronic autoimmune disease that can damage any part of your body, which can mean your skin, your joints, and other organs inside your body, like your kidneys, your liver, your spleen, your reproductive system. Any system or any organ, endocrine, like you say, your skin, it can attack it. So what is chronic? Chronic means that the signs and symptoms tend to last longer than 6 weeks and often for many years. So this disease is chronic, like I said, and it can last for 6 weeks all the way for years. And one thing about lupus is right now there's no cure. That's why I want to do these videos to bring about more awareness and hopefully more research, and people will want to find a cure for it. I know all of us that have it wants a cure for it, of course, because we want to feel better, but hopefully these videos will help. So yes, make sure you share these videos when I post them on Facebook. So to all my friends and family that follow me, definitely do that. But anyway, so yeah. So in lupus, something goes wrong with your immune system, which is the part of your body that fights off viruses, bacteria, and germs, and foreign invaders like the flu or a sinus infection. But when you have lupus, something goes wrong somewhere in there. Something's not right. And that's one thing, they don't know what goes wrong just yet. But normally your immune system produces proteins called antibodies that protect your bodies from these invaders. And autoimmune means your immune system cannot tell the difference between these foreign invaders in your body and the healthy tissues. So auto means self, and creates antibodies that attack and destroy healthy tissues. These autoantibodies cause inflammation, pain, damage in various parts of the body. So basically what I just read means that your body, auto, which is yourself, so yourself attacks yourself. So it decides that my body, those who have lupus or some other autoimmune type of illness, decides that let's just say today Ronnie's going to have the flu. So I will end up having flu-like symptoms, and my body sits there, and my immune system decides, okay, she has the flu, let's go attack. So it attacks me like I have the flu, but I really don't. So basically, you sit here and your body is working overtime, trying to fight something that's really not there. So that's where all the fatigue comes from that I've discussed in my vlogs, why I be so tired. That's because my body is constantly working itself. When you have the flu, you're so worn out because your body's trying to fight. Your body's trying to fight. But when you have an autoimmune, that's great when you have the flu. It's supposed to do that. You're going to be fatigued for a few days, a week, and it's over with. Just like that. And that's what it's supposed to do. But when you have a autoimmune disease like lupus and you really don't have the flu, your body's sitting here in a flare attacking itself and attacking healthy tissues and organs in your body for absolutely no reason. Like, it just decides to do these things. So it's constantly going and going and going for no apparent reason, causing actually more damage that can actually cause actual illnesses besides fake illnesses that your body is trying to attack for absolutely no reason. So moving on. And it discussed in the definition, these autoantibodies cause inflammation, pain, and damage to various parts. So one thing I know that I've discussed already with you guys is that my knees get inflamed. They constantly stay inflamed, and that keep me from walking too well. So they'll swell for absolutely no reason. And one reason why I was in the hospital just recently was because my ribs are inflaming. So I'm getting a lot of inflammation around my ribs, which is not good because it's so close to my lungs and heart. So like I said, it can attack any organ and system. So right now it's kind of very chronic, so I'm gonna have to really, really, really be careful and pay attention to my body, because your lungs, that's a really, when it attacks your kidneys, that's terrible. But you can live with one kidney and you can get a transplant for one kidney, but when it starts attacking things like your heart and you get the fluid around your heart, that is super, super dangerous. And even your lungs, things can just happen so quick. They can fill it with fluid so quick, and you just kind of be out of here. So right now, I kind of just really have to be careful with that and with the inflammation. So I'm kind of just taking it easy. But anyway, so lupus is a disease of flares. Now, flares are when symptoms worsen, which I think you guys picked up on now. It's when I always have symptoms, but flares is when they get really, really bad. So when the fatigue gets really, really bad and I can barely get up in the morning, or the room is spinning as soon as I open my eyes, like, that's how bad sometimes the fatigue can get. And I just have to close my eyes, and I'm not tired because I went to bed at 9 o'clock and I'm waking up at 11 a.m. Like, I'm getting enough rest. It's just, my body, even though I'm asleep, my body is still constantly working overtime, attacking itself. So, you have those flares, and it's when those symptoms get worse and you feel even more ill, or when your swelling gets worse, you feel worse when when the swelling is greater at times, and it may not be like and I mean by greater, like not a small difference, but a really, really, big difference, or something abnormal or something different from your last flare, or a different symptom can be considered as a flare. Some people consider anything as a flare, but I considered days where I have to use my walker to move around when I'm in a flare, or when I'm really, really fatigued. I consider that, and not tired, fatigue. It's definitely a difference between being tired or lazy or whatever. It's definitely a difference. At first, I used to think fatigue was like the same thing. It's really not. Like, it is terrible. But so lupus is a disease of flares, which I explained, and remissions. Remissions, of course, we know, just like with cancer, is when, your lupus improves. So you may not be in flare anymore, or improve to the point, you still may have symptoms, and you always have symptoms, but it may to be a point where your blood work shows that you're not a flare anymore. And there's particular blood work that, doctors do order for you to have done. And blood work is done pretty often when you're first diagnosed until you get manageable. My blood work is done every 2 to 3 months right now. And basically, every 2 months they check to see if my body is in, they're going to be checking to see if my body is in flare. And the 2 times I've been checked, I've been in flare each time, basically. So I haven't came out of a flare since December, and it's now April. So going back to my definition, flares are when symptoms worsen. So I've pretty much been at my worst, I guess, of things so far. So I've been at the worst of it, and that's not to say that things can't get worse, because like I discussed, that it can attack your organs. Hopefully and prayerfully, that does not happen, but it is very common to happen. So, at least I'm well versed on it, and it won't be a surprise to me if something like that happens. But, we're just gonna hope for the best right now. But anyway, that's pretty much my definition of lupus, and I hope you guys could kind of follow that. It wasn't the best, but I think you guys get it, that it's not curable. Flares are when things worsen. Remission is when things they're not great. You still have symptoms, but it's when things are better, and that it can attack. It's chronic, and it can last for a long time, and it's not curable. It can attack pretty much any part of your body, and it's an autoimmune disease that it's your immune system. It consists of your immune system. So I think you guys got it right now. Hey, anybody, strangers, friends, or family, I encourage you to read about it. Educate yourself, because it is common. And I'm going to say this to anybody. Definitely educate yourself, but this is a common disease in colored people. So it's most common in African Americans. So I really encourage you, African Americans, to read up on lupus. Lupus goes undiagnosed for years. I'm 25 years old, and as I look back, I've had symptoms since I was a little girl. And to be honest, my cancer experience more than likely was caused by my lupus, because lupus and lymphoma is very closely related. I'm just going to throw this out there. One, like I said, one of the symptoms of lupus causes inflammation. So holding a lot of inflammation can eventually do what? Cause cancer if it's not managed. So the lymphatic system works very closely with your immune system, and the lymphatic system, consists of lymph nodes, and I had lymphoma. So it's very common. Of course, we're not sure. You can't say what caused cancer, but just looking over the past and discussing with my doctors, it's very likely that, I had lupus before I had cancer when I was 16. Like I said, I'm 25. These things go undiagnosed. Little signs and symptoms will happen, and then bam, you go into this big flare, and like I said, the next day, you have lupus. You're disabled. You can't walk. You can't do the same things that you did before yesterday. You end up in the hospital randomly and for a week, and then the next day you go home, you're, looking into disability possibly, or you don't know when you can go back to work or what have you, or if you can work. So, it can be a bit much. So I encourage, especially my African American, and like I said, it's most common in women. to just look it up and read up on it. Now, I'm not saying don't every symptom. You might have every symptom, but it might not be lupus because lupus is known as the great mimicker. It mimics a lot of diseases. It's very deceiving. That's why it's so easy and it's so easy to miss it. So that's why takes so long to diagnose or to catch it because like I said, it can mimic the flu. It can mimic it can mimic a lot of things. So when I say look it up and stuff, don't get scared that you have it just because, oh my God, you know how we get when we get on WebMD or, something crazy like that. We're up here to, oh my God, I have this, and we're diagnosing ourselves, going crazy, calling a doctor. Yes, call the doctor. I mean, when you go to the doctor, definitely get your blood work done, but there's certain tests that have to be ordered specifically for lupus. But like if you're having a lot of swelling and stuff like that, I kind of like encourage you to speak with your doctor about it. It could be that you do have lupus or something similar. One thing that another illness is RA, rheumatoid arthritis, which is another autoimmune disease, very similar to lupus. When we think arthritis, we think, oh, you just have aches and pain in your joints. No. It's also like lupus. You have fever almost constantly, and your body's attacking itself, kind of just like lupus. So, lupus can mimic that. And I also have RA too on top of my lupus. It's caused arthritis in my knees that I'm actually going to have surgery on very soon. Well, I don't know very soon. I'm kind of putting it off. I'm honestly waiting for my lupus to become more manageable because I don't want to have surgery on my knees to clear out the arthritis right now because I'm scared that all it's gonna I'm glad that it'll be cleared up for a while. I mean, I'll do anything for a week or a few days of relief, like honestly, but I just would hate to have surgery and then have to have surgery again because if my lupus isn't managed and my knees start swelling back up and staying swollen, it's just gonna set right back in and I'm gonna have to have that surgery again. But I guess it's just how it's gonna go. So you don't want to continue to have multiple surgeries and going back into the same spot, causing scar tissue. That's even, that's kind of even worse. More pain. Don't want to be doing all that. But I will try it once. And then if that helps, I'm trying to wait. I'm trying to see if a lot of my swelling will go down since it's getting warmer outside because the winter is when flares do increase for a lot of people as far as inflammation. So, and that's very true for me. So I'm hoping that the warm weather that's starting now will actually get these knees going down. So we shall see. And I'll go ahead and do it then. So I'm thinking maybe I'll take some time off. What's this month? April. Maybe June. May. Yeah, maybe June. I'm gonna take some time off and get my knees done. Cause I'm gonna need some time off for that. So I'll keep y'all updated. But like I said, I wasn't gonna go into all that right now. But anyway, I have some quick facts. I'm just gonna read them. I'm not gonna explain them. But some I will dive into. So basically, I went over them. I already talked about them. But I will throw some things out here that I did notate. Like I said, it was more common in African Americans, for some reason, people of color. So, like, your Hispanics is common. It's kind of strange, like, why people of color is it more common in? But, That's okay. I don't know. I don't know why. I don't know. But of course, if you're Caucasian, get checked too, because I have a lot of people that I do know that are Caucasian that have lupus in my support groups and everything. And to be honest, I see more Caucasian people um, right now than I do see African American people in my support group. So, hey, it doesn't matter. That's just what science says. But who knows? Because they don't even have a cure for it. So, who knows? It could be more common in Caucasian people. I mean, it seems that way to me from what I see personally, but whatever. But so another fact that I didn't hit is lupus is not contagious. Not even through sexual contact. You cannot catch lupus from someone or give lupus to someone else. So it's not, when you say autoimmune disease, a lot of people go to, oh my God, HIV or like AIDS. Yeah, those are autoimmune diseases that you can catch, but lupus is not one of them. It's totally internal. Like if we have the flu, if someone with lupus has the flu, of course you can catch the flu from me. But if it's one of my flares and I don't really have the flu and I'm just having symptoms of it, you can't catch my fake flu or my lupus symptoms. But yeah. Let's see. I did tell you how lupus can be life-threatening, but some people have very mild conditions of lupus, so it can range from mild to life-threatening. And either way, it should be treated. Whether a doctor tells you it's really mild, don't let them just tell you, oh, you have a mild, or you might have lupus, or we see something in your blood work concerning that could be lupus or some type of connective tissue disease, and they just let it go like that. No, you need to be treated. So you need to be on a medication. I'm not going to say which one, but there's a very common medications that most doctors put their patients on, whether they know they have lupus or not, or something similar, because it does take a lot of testing. They put them on it right away. It's actually, I'll go ahead and say, it's actually called Plaquenil or hydroxychloroquine. And I noticed a lot of people with mixed connective tissue disease, which I do have as well, and lupus are put on that medication right away. So fire your doctor if they fire them. Like, you need another doctor if they say anything like, you might have lupus, or you have mixed connective tissue disease, or you might have something similar or something like that. Fire your doctor, because there's medications that's supposed to, according to our doctors and what they say about these medicines, supposed to kind of slow down the progression. So you need to be on something to start slowing down the progression as soon as possible. So fire your doctor, find another doctor. That's all I can say, because that's very important. Let's see. Okay, so I did say lupus is most common in African Americans, but it is most common in women too. So not a lot of men have lupus. Like I said, research still needs to be done on lupus. Don't know why, of course, just like a lot of other diseases. And the age range that it strikes is usually between 15 and 44. So that's when which is your childbearing years. So that's when most women find out that they actually do have lupus. And to be honest, from people that I've spoken with, even in my support groups, a lot of their first flares, or when they first found out they had lupus, was either during their pregnancies or after their pregnancies, because it threw them into this big, wildfire and just things, random things just start happening to their bodies because of, I guess, the body trying to attack because, there's something in your belly, there's a baby in your stomach, the body thinks it's an invader or, just something crazy that the immune system thinks. So it's very common in your childbearing years, basically, to notice the disease or to be diagnosed. So ages 15 to 44. And yeah, I think that is pretty much about it as on my notes that I have as far as lupus. Yes, and I will discuss some other things in another video. I'm trying to think of anything else. And this is all new to me, so I'm sure my views and my definitions as I go throughout this journey will actually change. I'm very sure my views on cancer has changed over the past 7-8 years. From the beginning to the middle till now, and my views and definitions will just probably change for the rest of my life. But right now, for the first few months, that's what I know about lupus. I'm gonna put it that way. So if you're a beginner, this is a good beginning state for you, I guess, as far as how I explained it. I'm trying not to be too negative about the disease. It is a very life-threatening disease, even if it's mild. Symptoms, like, this is a disease of progression. It progresses. Medications just slow it down. So, like I said, I like to be positive, but it does, in reality, it does get worse. This disease gets worse. There's so many people that I've talked to. Like I said, when I say people that I've talked to or people that I know, I'm referring to people in my support group, because I do have a support group. Don't be ashamed to become a part of a support group or support groups. I have like 3-4 different support groups. You need it. So no matter what you're going through, even if it's depression, get in a depression support group, but don't become, I guess, consumed in it. Still, live your life, because people do a lot of ranting in these support groups and complaining, which is okay, because sometimes I get on there and rant and complain, because these are people that understand, what I'm going through, or will understand what you're going through if you come a part of these groups. So it's good to, it's really good, mentally and emotionally. So, I forgot where I was going. Forgot where I was going with that, but don't be ashamed. You have to do it for yourself. It doesn't matter what other people think. So don't be ashamed of it. I'm trying to think of something else that I can discuss, but I think I hit it all. But like I said, oh yeah, that's where I was. Like I said, I like to be positive, but this is a disease of progression, so it will progress. So that's where I was going with the support group. So yeah, when I say people that I know, I'm referring to my support group. So people that I know have gotten, as far as progression of disease, have had to get, because of inflammation, settling, and arthritis, and just other crazy stuff, just your body attacking itself, and the tissues, have had to get kidney transplants, blood transfusions, hip replacements, knee replacements, just a lot of different things. They have bulging disc in their back, in their necks, brain surgeries, just so many different things. Like, it progresses and it does get worse over the years. Some people, it doesn't affect their organs. I don't know why. Maybe they have the more mild form of lupus. We don't really know what that is, but I guess some are just worse off than the others. and just the body. Everybody's body is different, but I already know that mine's do attack organs because it attacks my body systems because it does attack my nervous system really bad. When I was first diagnosed, I could not see for weeks, and then after that, my vision was still blurry for weeks. So it attacked pretty much, I guess you would say, my brain. So it attacked my brain, my spinal cord, because I couldn't move for like 2 or 3 days. I was literally like stuck, pretty much just like that. I couldn't move my body. So when you can't like move your body like that, that's your brain. When your brain can't tell your body to move, like, that's part of all that. So we know it attacks my nervous system. Something else different that I'll talk about in my signs and symptoms discussion, because I'm gonna have to write them all down. But I've already talked about that before, so y'all knew about that. So yeah. I know it's kind of boring, probably, and I'm not all happy and giddy because, like I said, I was in the hospital yesterday, and I'm still not feeling good. Like I said, my ribs are killing me. It hurts to talk, but I've done like 37 minutes of this video, almost. So I think I did pretty good. I'm getting a little bit windy, I guess you would say. So my next few videos will be about my diagnosis, my signs and symptoms. Then I'll talk about other diseases that come with lupus. I already talked about RA. And then I'll probably discuss like my medications. Then I'll go into the difference between my cancer experience, which you guys know that I always talk about, if you're one of my friends. And I'll talk about the difference between that and so far the lupus. Then I'll get into some more things, about my daily life, my care. I'll talk about depression. I wrote it down. I'll talk about diet, must-haves when you have a chronic disease, traveling with a chronic illness, because I am about to make my first trip in a week. And it'll be my first time flying, so it'll probably be a bit, not first time flying at all, but first time flying or traveling with lupus. I've traveled before with cancer, but it's totally different. When I travel with cancer, did I ever fly? I don't think I flew. I think we just drove. Yeah, we just drove mostly. I don't know why, but so it'd be a little bit different because having to go through security with your medicines and, just making sure you have everything you need, and then having to have extra because you just never know. So, yeah, I'll talk about that. And then I'll be doing some videos, like probably record when we're on vacation. I guess it's a vacation because I need a vacation. I know y'all probably like, you've been out of work for almost 3 months, but guess what? I was at work in a flare. I'm still in a flare, and I'm like, the heck with it. I'm going on freaking vacation because who knows when in the world I'll get out of a flare. But at least my mother will be going with me. So I'm glad about that. So it's not a long vacation. It's just like Thursday through coming back Monday. So I'm very excited. I'm going to see my family in South Florida. So that's always a good trip. So while we're there, we'll probably record a video because that'll be when I'll see my mom again, and we're going to discuss like medical leaves, So me as being a patient of medical leave, having medical leaves, also work accommodations, when you have a disability, what you're entitled to, and then medical leaves as a parent or a caretaker, because you are entitled to those if you're a parent or a caretaker, like if you have a child who has some type of disability or chronic illness. So that can happen. So I'll talk about that, my diet, stuff like that. So I'll also do a video the next time I see my dad, and it's gonna be on grocery shopping because he is the main one that did grocery shopping with me in the beginning of my journey, because he was actually off work for the first 6 weeks from when I was in the hospital, because he had surgery. He had surgery the Friday, the week before. Yeah, he had surgery the week before, the Friday before I went in the hospital that Wednesday. So I was kind of grateful that he was off, because he was able to, kind of like stay home with me after my mom had to go back to work. So we did most of the grocery shopping in the beginning. So we'll talk about grocery shopping. I guess that'll go into my diet video too. So he'll probably do that with me. That video too with me. We kind of just merge them together, I guess. So it won't be too long, drawn out videos, kind of like this one. So yeah, but I just kind of wanted to say, some of the things I'll be discussing. I'm also going to discuss other stuff, like when you tell someone you have a chronic illness or that you had one. Because I know, like, when I say someone, I mean, like, maybe someone of the opposite sex that you really like or want to date, or that you are dating. Because, that's something you may feel intimidated about saying to someone in the beginning, or saying to someone at any time. So I'll kind of discuss that, because I've kind of been through that with a few relationships, and each relationship is different on when you, yeah. Anyway, I'll talk about that later. So that's a whole nother video. So I'll be talking about more life type of things, not just, lupus. So if there's something I say, hey, I want to discuss that, I'll still put it on my video blog, on my YouTube. I'll still discuss other things too as well. But this channel will be mostly about my lupus experience. So yes, we gonna get that clear. But there will be other things that we'll talk about that will pertain to everyone, and I'm sure in some way this pertains to you. I mean, there's people. I have a friend with endometriosis. This video, and I have an aunt with endometriosis. This video, you can find something that you relate to from this video, I'm sure. So it kind of just, like, what you can feel depressed about your endometriosis or what you have to go through, because it can cause you to not have children, or anything. Someone with Crohn's disease, you can be depressed because of that, because it's just a depressing thing when you can't go to the bathroom, or when you go to the bathroom too much. Like, any type of situation, or no matter what, you can relate. You can kind of relate to somebody, or find something that's going on to relate to them. So I'm just babbling, and I'm watching Miami against Charlotte, and right now it's the third quarter, and it's 87 Miami. And I want to say I'm not a Miami fan, but I just go for them because it's home, South Florida, like I mentioned, and that's the only reason why. I just go for them. But the only time I don't go for them is when they're playing LeBron. See, I really don't have a team. I'm just a LeBron fan. And I've been very disappointed in LeBron, I'm not gonna lie. I haven't watched hardly any games this season. And I know y'all probably been like, oh my gosh, you've been at home. Like, I've pretty much been binge watching shows, to be honest. So right now they're beating the Charlotte. Yeah, they're beating Charlotte. They're 89-65. So yeah. Well, Charlotte just scored. So 89-67. Third quarter, 3 minutes left in the game. So 3 minutes left in the quarter. Sorry, I'm getting all mixed But anyway, yeah, so I wanted to take the time to do this video. I've been waiting for so long to sit down and actually do a video for you guys, just to kind of let you know what lupus is and some facts about it. So I hope you enjoyed it. I'm hoping it will help someone that maybe think that they have something going on with themselves, or it's just recently diagnosed, or someone that's not, who have been diagnosed forever and just was scared to, learn about it. Because, I mean, it's a scary thing, and people put things off, so you never know. So anyway, I want everybody, like I said, to either have a good week, good weekend, good midweek. Like I said, whenever I post this video, have a good one. All right, guys, I will see you all later.